This episode is supported by Movember, the leading charity changing the face of men's health.
Welcome to Be a Boy podcast with me, Elliot Ray.
And me, Jolie Braley.
Today we are talking about the health of men and boys. 75% of suicides are men. Suicide remains the leading cause of death for men under 50. Men are more likely to die prematurely. They live around 4 years less than women. In the most deprived areas, men die up to 10 years earlier. Men are more likely to be homeless, be in jail, and addicted to drugs and alcohol. And to add to that, they are less likely to seek help, often suffering emotional and physical pain in silence. I acknowledge that's probably the most depressing start to the podcast. Sorry about that. But in a world where we recognise men's privilege, we have only recently started to have a mainstream and national conversation about their pain. And the good news is that this has resulted in the UK government publishing its first ever men's health strategy last November to try and address some of those poor outcomes. So today we are talking to Paul Galdas, Professor of Men's Health at the University of York, Jolie's neck of the woods, and Chair of the Men's Health Academic Network, who was instrumental in developing the Men's Health Strategy. This conversation will help us all understand what's going on with the health of boys and men, what the government is doing about it, and importantly, how parents can support their boys' health. Welcome, Paul.
Thanks. Great to be here. Thanks, Elliot.
Lovely to have you. So, Paul, talk to us about being a coronary nurse back in the day and treating men who had delayed seeking help for chest pain. That must have been so insightful, and you must have had some really life-changing experiences. What was it like meeting and treating some of those men?
Yeah, it was life-changing. It was formative, really, in terms of how it informed the rest of my career. And many people don't know that I started my career as a registered nurse. Well, I'm still a registered nurse now, although I wouldn't go anywhere near clinical practice. I don't think I'd be fit for practice right now. But I used to work as a coronary care nurse, as you say, looking after guys and women who'd experienced heart attacks and acute cardiac problems. And I was in my early 20s and looked after a lot of young guys that we saw come in, sort of in their early 40s to early 50s, sort of the age that I am now. I noticed that they were really uncomfortable in hospital, really ill at ease with the whole system. And as a young lad from a working class background, I found I connected with them a lot of the time, and I almost made it not my clinical specialty, but I kind of gravitated towards those guys because I feel like I could almost speak their language, and I was really interested in listening to their stories. And what was really common was almost all of them had a story around putting off going to the hospital and going to the doctors when they were experiencing chest pain for as long as they possibly could. It was really, really a common story. And when they looked back on the reasons why, it was that they were trying to carry on work or carry on with their responsibilities at home. And they knew something wasn't right, but often would wait until the last possible moment where they thought, I can't cope with this any longer and I need to get help. And often it was their partners or close family members who ended up calling the ambulance or calling the doctor out. And so really that was what stimulated my original thinking around what's going on here. Like, why are these guys feeling like they can't reach out? Why have they delayed? And it really had an impact on, their prognosis and their health afterwards. And so I ended up doing my PhD in that topic at the University of Leeds in early 2000s, looking at what are the decision-making processes for men who experience cardiac chest pain. And importantly, my interest at that particular time, and has been throughout as well, how does masculinity influence those decisions? So yeah, it's something that I still think about. This was over 20 years ago now, but we're still kind of grappling with some of the same sort of issues when we talk about it in terms of men's health.
Yeah, I met a guy a couple of years ago and he was telling his story. He'd had a lot of pain in his kind of lower belly area for a long while, and he was urinating a lot in the nighttime, and he basically ignored it over and over again for months until he woke up one night and plus blood in his urine. And he wanted to ignore it, but his wife was like, literally go to A&E, and he went to A&E and he had testicular cancer. And if he hadn't gone that day, who knows, but he's had an operation and he's fine. But I remember him saying, even when he went to the doctors and he was in A&E, he still didn't really want to tell his workplace about what had happened because he had a team and his idea of masculinity was wrapped up in work and being present and whatnot. And I hear that so often. I mean, I used to be like that. I've changed now. I go to the doctors for anything. They're sick of me. I go all the time. But recognize what you're saying. Why do you think it is that like so many men just ignore symptoms and they don't go to the doctors? They ignore what's going on in their body?
I think it's a complex problem, and we kind of look for simple answers to this in many ways. But I think the important thing to emphasize that whilst stoicism and solving your own problems and some of the sort of common attributes around what it means to be a man in society today play into this, the challenge doesn't reside in individual men. It's how the health system and our structures around how men live, work, and play responsive to their needs. And I'll give you an example of that. That kind of connects with what you just said there, Elliot. That I need to make a GP appointment. I called my GP yesterday, and they said, it's a bit late to get in before the time you need to, but the doctor can call you between 12 and 5 on Friday. So I was like, okay, well, that's fine for me because I sit here in my office, and I can take a call. But if I was, an electrician working on site, that's not going to work for me. Or if I was a school teacher, the system isn't as responsive as it can be, and we know that it's not just about, if we put in place services that are responsive to men's needs, then men do go and they won't ignore symptoms and they'll take early action. And one of the big problems that we do have in relation to men's health right across a range of conditions is supporting men to engage with services before crisis point. And so the whole men's health strategy is around shifting the focus away from thinking about why are men not doing what we want them to do, going to the doctors earlier or taking actions in order to maintain their health, why the system not reaching men and engaging them in a more appropriate way that reflects their needs, preferences. And one of the things that I say to kind of bring this to life, and I love an analogy, is that the health system's like the high street, right? And for a long time, in relation to men's health, we've thought, well, why are men not rocking up at the high street? Why are they not showing up? We need to tell them more about the high street and tell them why it's good to go there, rather than thinking, what is it about the high street that's not appealing to men? Maybe we need to change the opening hours. Maybe we need to take some of the shops closer to where they are. Maybe we need to add in some things within that high street that are genuinely appealing to them. And so it is about not just thinking about the deficits that men may have, but actually how can we have a system that's more equitable so that it works for everybody, including men, and particularly men who are facing the greatest disadvantage within society.
So women, in my view, without reading the data, I think, from my friends, we happily go to the doctor all the time. But I always think that's because we are forced to interact with the medical profession regularly from a really young age because we have periods and because we can get pregnant and because we have to go on the pill and we have to have things shoved up us a lot to check that everything's all right up there.
Yeah.
So we just get much more used to going to the doctors than boys and men do. And often the first time perhaps a boy might or a man might go to the doctors is because there's something specific to them. Whereas for girls, it's just a regular, part of being a girl. Do you think then there's perhaps something you can do at a younger age to engage boys in the medical profession?
Yeah, absolutely. And the evidence bears out what you've just said there, and is that women tend to have natural touch points across their life where they have to engage with health services, reproductive events being the main ones, whereas men tend not to have that. And if you look at the data, patterns of engagement between men and women diverge. They're massively different in the working ages. Only at the very beginning of life and at the very end of the life are the same. And even if you take out female reproductive events, actually, there's still a big gap between patterns of consultation. So to expect a lot of guys to access a system that they have little familiarity with, that they feel like they they're not confident, don't know what to expect. It can be a real challenge. And part of the solution here, as you've said, is around normalizing that level of engagement from an early age, but also making sure that the services feel welcoming and normal for boys and young men at an early age as well. A lot of the evidence points towards supporting men to understand health as an asset rather than as a deficit. I mean, we often frame health around the prevention of illness. You must do this, otherwise this might happen to you. But actually, if we frame health around it, staying well, staying strong, being able to be more active as a father, as a colleague, and as a friend, those things tend to resonate better. It's seen as a strength and as an asset rather than as a deficit. So moving away from this sort of, I've never been to the doctors in my entire life, as almost a badge of honour, to developing services so that guys see it as appealing and normal. And fatherhood actually is a key, and the men's health strategy touches on this life transition point where men can naturally start to engage with services. And again, but if systems are not shaped to value men's contributions as fathers in their own right and support them to take their child to the doctors to get their immunisations, or workplaces are supportive to enable guys to say, I've just had that call from nursery, I need to go pick up my child because they've had 3 loose poos or whatever, and I kind of need to take them to the doctors. It won't again support that development of that familiarity. It's not just about telling guys to behave differently. It's around how the systems and structures around them are creating norms for what it means to engage with health and health-related behaviours and services.
Because the system is actually actively hostile towards fathers, from my experience. Like when you're pregnant and the father comes with you, I know that my partner felt very excluded and ignored and not consulted with whatsoever. And then when we had our first son, we had some significant problems in his first few weeks of life, and my partner took my son to the hospital, and they said to him, where's the mother? Why is she not here? And they never said to me, where's the father, when I took him on my own. And he was like, on the back foot, felt really sort of awkward and embarrassed about it.
Yeah, and I think that's a common story that I've heard and is reflected in some of the research evidence, is that I would frame it as that services and systems are not father inclusive or family centered. That we talk a lot about family centered approaches and about father inclusive services, but the reality is still at the moment they aren't set up to reflect fathers' roles as parents in their own right. Often I think fathers' roles are framed around support for mum, support for kids, but not actually the role of the father. I mean, these are deeply ingrained norms as well that reflected in systems like maternity services, like parental support services. We've been talking a lot recently about family hubs and making sure that they're family centric and father inclusive as well. And we need to move beyond rhetoric around that, just saying we welcome fathers or a poster up there or painting something blue, it's not going to wash that. I think it kind of needs to be co-designed with dads. Dads need to be, and families need to be part of the design of services. And again, this is something that I talk about when we talk about what does system change mean, like what we're talking about. And I think father is a really good example in that. We kind of can put together a fatherhood program where you can get dads together. But really what will affect sustainable change and real change is around changing policy so that, dads are welcomed, dads are included, and we don't kind of talk about them as almost like a side issue that we can do in a particular separate program.
Yeah, I remember going to my eldest, who used to have really bad allergies. And so you used to get these annual checkups. And I took her many years ago, maybe 4 or 5 years ago, to one of the checkups. And I'd had her on my own for a couple of days. We went to the appointment and the nurse was asking me, what did she eat yesterday? So I told the nurse and she wouldn't believe me. She was like, well, I need to call mum. Mum will know. And I was like, no. Like, mum was at work yesterday. This is what she ate. And she wouldn't have it. And she got my wife's number from the file and called her up. I was like, what did your daughter eat yesterday? And my wife was like, I don't know. ask her dad. It's crazy. In regards to like offering services that are inclusive to men, in Parenting Out Loud, we've worked hard over the years to learn the lessons from the medical profession in terms of language, in terms of activities, in terms of framing it around performance, making it clear what we're going to discuss and how they're going to benefit from it. But it can still be a struggle to get men along. We can have events at a football stadium and there's football players there and they get a stadium tour and a free lunch. And still some men will be like, I'm not sure. So that the barrier is real. But I wanted to ask you about parents and what do you think parents can do, parents of boys, to encourage them to seek help when they need it from a young age? What would your advice be for parents listening?
Well, I think the first thing is what not to do, and what not to do is telling them off, saying that they're bad or that they're behaving badly. I think that rarely works in most parenting contexts when we're talking about modelling positive behaviour, when we're trying to encourage positive behaviours. And that modelling is probably the most important thing, I think, is that boys learn norms around what it means to be a man through various different messages that exist not just within the family, but also in the communities and systems around them, school, media, and so forth. But respond a lot to what they see, not just what they're told. And so, I think having father or male role model who models those positive behaviours around proactive engagement with health services, and not just health services when we're poorly, but being able to demonstrate vulnerability, being able to say this that these are concerns, and it is a great strength and shows self-respect in order to kind of look after your own health. I think that is really how parents can best affect how boys can grow up thinking about what does it mean to be a man and look after your health. In the same way around physical activities as well. You can see this in families, that if your parents are kind of into doing running, sport, hockey, football or whatever, the kids are kind of more likely to go into that. If you have families with loads of musical instruments around or books, then the kids naturally kind of engage in those things. So it is a sort of a normalization of patterns of role modeling and connection. And I think that's the thing as well, is that keeping the door open, even if boys are not willing to talk about some of their health fears or health challenges, maintaining that connection and keeping that door open is massively important. And as a research scientist and as an academic, I tend to just focus mostly on the evidence and don't talk about my own personal experience. But I will talk about a personal experience because I've got an 11-year-old son, so I kind of live in these challenges, and we got him I've got an older daughter as well, 16-year-old daughter. And when she was going through puberty, we kind of got her a book, and said, this is the book, How My Body's Changing and so forth. And she was avidly reading it and the questions come in. So we've done the same for my son, who's kind of going into that tweenagery thing. Well, he hasn't looked at it. He don't want to talk about it, doesn't want to touch the book. Doesn't even want to so we're like, what do we do then about this? So anyway, we just kept the book sort of somewhere with the thinking, well, keep the door open and maybe talk about it at some point when he has to. But rather than, I think berate him and say, well, this is something that you really need to learn and understand. It is about that maintaining connection. And so I guess the thing that I can say there, Elliot, is that I don't know myself either, really.
Yeah, we're all learning. We're all learning. I've got a 10-year-old daughter and we need to get her a book ASAP. But on the role model thing, I definitely relate to that. So we've got a builder, shout out Kenny, and he's maybe in his 60s, but this guy is in shape. Like, sometimes in the summer, he takes his top off and walks around the house. I'm like, okay, Kenny, cool. Let's do what you're doing. But he's in shape. And he's always says to me, like, I go to the doctors all the time. And he said that to me about 4 years ago. And I think that has seeped into my psyche. Because I looked at him and I was like, if I can be like that at 65, I need to start getting my checkups. So yeah, great advice there on role modeling. Let's talk about premature death and some of the risks. So we know from the strategy, it highlights that men are more likely than women to die as young adults, and particularly from external causes like accidents, violence, overdoses, and suicide. I want to ask your opinion on why you think that is. Why do young men have this elevated risk of passing away from these external causes?
Yeah, again, it's complex, and rarely is there one factor that's contributed towards it. It's kind of an accumulation of risk across societal norms and risk taking, substance abuse, alcohol and drugs that tend to be more common amongst younger men, distress and emotional inexpressiveness and socioeconomic disadvantage that kind of all comes together to what we say in public health is a compounding of risk. So each of those different factors elevates risk, and that's why we see patterns of poorer outcomes across some of those key issues. And the same goes for men as well. And as they go into the older ages, when we look at patterns of suicide and death by suicide, it's again multifactorial, associated with socioeconomic deprivation, financial problems, relationship breakdown, and stress, and a range of different factors, as well as substance abuse as well. So, the solution then has to be around tackling some of those issues earlier and providing support, again, trusted, accessible support for a range of those issues early, so that we're not just responding when crisis happens, when those problems start to manifest. And so, we need to be working with boys and young men to learn what it is that they need, what is trusted support, what does that look like, and it might look very differently to what we think they might need. I mean, we just talked about books and giving your young child a book. That's me saying that as somebody who reads books. They might just want they want something digital. They might want something somebody from a peer group who's not a health professional, or who's from their community, who they know that they can say things to, that's not going to get back to either school or their workplace or their parents. Those things tend to be reflected in the evidence around various different issues about how we design services so that they reach and engage boys and young men earlier. About meeting them where they're at so that they get the support that they need early. And again, like I said right at the beginning, Elliot, it's the challenge that we face with a lot of boys and men's health is around shifting support away from crisis response to proactive early engagement.
So what would you say are the main things from the men's health strategy that are kind of aiming to address particularly like overdoses and suicide? Is there particular interventions that you see in the strategy that would help?
Yeah, I mean, the main take home, I think, from the strategy is that it shouldn't really be viewed as a sort of a collection of interventions, but more around a call for systems change. And there's some headline things in the strategy that are important, that will help sort of build momentum around change. So, partnership with Premier League around suicide prevention and investment in community-based programs, for example. But really the success of the strategy will be around how local health systems respond to the plan and its framework. So, and when I say local health systems, I mean what are local authorities do differently, what are integrated care systems that oversee NHS services within each region, how can they respond? So it's not necessarily about straight away doing new things, but more around, I've been going out and speaking with local authorities. I would say, you will have existing smoking cessation services, gambling and addiction services. Do you know who's showing up to those? And importantly, which guys are not showing up to them? Who's been missed? Where are the guys who are falling through the gaps? And then thinking about, well, what do you need to do in order to change those services and systems so that they are reaching those guys? And really that's the focus. It's around the men in society who the system is missing. And so that'll be different across different regions, but fundamentally the general principle that this is not just about individual men and their behaviour, but it's about reshaping our health system, our high street, as I said, so that it's equitable for everybody, and particularly those who have got that accumulation of risk, the greatest disadvantage.
Reading the strategy, there was one bit that kind of really made me sad, to be honest, and it was that 6%, around 1 in 10 men in England say they are often or always lonely. And it also said there is some evidence to suggest that young men may be more likely to say loneliness is something to be embarrassed about. And I read that and I had to pause and think about that deeply in regards to just my own life and whether I have been lonely and really interrogate that, but also to think about, would I be embarrassed to say I was? And I probably would be, if I'm honest. I would probably be quite embarrassed. I wouldn't admit that I was lonely. I would see that as a deficit on my part and I would feel judged by it. So what do you think about, I guess, big question, but why are so many men lonely? And also, do you have insights into how loneliness impacts wider health outcomes as well?
Yeah, I mean, it's a big issue. It's a big public health issue for both men and women, actually. In patterns of loneliness, rates of loneliness are increasing. But you're right in what you say in terms of the reluctance to admit or accept feelings of loneliness. We did some research a year or so ago here at the university around men's experiences of loneliness, and we used a number of different scales to assess their perceptions of their loneliness. And what we found was that men were reluctant to respond to a direct question around, are you lonely or not? They were more likely to say no. But then when you looked at the responses to the other questions that related to being lonely, it was clear that they were around lack of social connection, feelings of isolation. So there's a clear disconnect between what was actually happening and how they were willing to respond around it. And in many ways, maybe even asking that question around loneliness might not be helpful. It's in the same way that using diagnostic labels for mental health, depression or anxiety can sometimes be unhelpful for men. But what we found in terms of loneliness in men was that it wasn't necessarily about isolation. It was around social connection and belonging and meaning. And what mattered most for a lot of guys was feeling like they were part of something. And they could be alone. There's a difference between being alone and being lonely. But really, what was key was feeling that connection, that they had belonging, meaning, and attachment to something that was important to them. That could be through work, could be through hobbies, or through community. And I think, as we're kind of just beginning to unpack really what are the reasons why we're seeing these increases, male friendships and decreasing, for example, and feelings of disconnect. And I think that there's been a big shift since the pandemic as well. But we know that improving those social connections can be a health intervention of itself for men. It has strong protective factors across a range of different issues, particularly around mental health and suicide. And so, again, that's an example of how, when we're thinking about how the system's working within our communities, are they affording opportunities for men to build those social connections, particularly guys who were, like I say, who were at the greatest risk. So we know that being lonely is the equivalent of smoking 15 cigarettes a day in terms of your health. Like, it's really bad. It is very, very bad for your health and well-being. So
yeah, after I meet with my friends, I just feel so much better. And it's the sort of thing you do and you're like, we should have met up like months ago. Why did we delay this? Because you just get a feeling that you feel like grounded in yourself again. And sometimes when we do our Parenting Out Loud events, one of the main things that come out, we hear from men and dads, is they don't allocate time for themselves. So they feel stressed out with everything that's going on. They put a lot of pressure on themselves to be strong for everyone else, to do this, to work. These are very involved dads, they're doing all the stuff. And the main conversation comes back to, I have no time to do anything for myself.
Yeah.
And so we always get into a conversation of like, what can you do? Can you find 15 minutes in a day? Can you find that club you go to every other week? Like, how do you speak with your partner about making time for each other, join the football club, whatever it is? And that tends to be 99% of the time, like the thing that helps men so much.
Yeah, and we took that approach actually in a mental health program that we developed. We developed and tested in NHS frontline workers, men who was working as paramedics, doctors, nurses, physios, and maintenance workers and things. It's called behavioural activation. So it's a well-established program, a little bit like CBT, but it focuses on behaviours and how they connect to how you feel, rather than thinking about patterns of cognition necessarily. And a key part of that is around helping guys identify what are the things that they are doing that help them feel well, and what are the things that they are doing in order that don't make them feel great, with an understanding that when things happen in life, work pressures, becoming a busy parent, illness, those things, we can sometimes cope by stopping doing the things that help us stay well. Because, and an example being, I'm just knackered when I get home from work, so I'm not going to go to the quiz night tonight. I'm not going to go to my run club or whatever. I'm going to go to bed early. Now that can work as a short-term coping strategy, but as long-term, it can lead to avoidance and withdrawal. And so what our program attempts to do is support guys to just schedule those things and do it even if you do not feel like doing it. Yeah. So it's taking action. Don't wait to feel better before you take action. Take action and then you will feel better eventually. And that works for a number of reasons. And it's, again, well established in the psychological literature. But for a lot of guys, it was about providing them with the tools to make the decisions and goals and actions themselves. And that's a big thing that we miss around men and mental health, is that men will engage, they do care about their mental health and well-being, but often just need to be given the tools to be able to take those actions themselves and look after their mental health and well-being, rather than feeling like I've got to hand over all of my problems and vulnerabilities to somebody else, and that can be a bit too much. So it's a really neat way of thinking about how to stay well, is just look across your week, rate it 1 to 5, how things are making you feel, and can you put some more 4 or 5s in there, even if it's 15 minutes, even if it's 30 minutes, because if your week's just full of 1s and 2s, then that can lead to downward spirals. So yeah, that acting, I really like that, the acting before you feel better rather than waiting to feel better to act.
I love that. 1s and 2s, 4s and 5s. I'm going to do that. It must start early, though, as well, because, I've got a real bee in my bonnet at the moment about the lack of youth clubs. There's no youth clubs around here, and there's kids running feral, and it's they've just got nothing to do.
Yeah.
And we know that boys can gravitate towards computer games and staying in their bedrooms and just being completely isolated playing computer games. Is there anything in the men's health strategy around boys and how we make sure that we reduce loneliness for them? And are youth clubs in the men's health strategy, I suppose, is my direct question.
Yeah. No, I don't. Yeah, well, I don't know whether youth clubs are specifically. Screen time is, though. Screen time and the detrimental or potential detrimental impacts of screen time is going to be a key focus of the work of the academic network that I chair at the moment, and the future programs of intervention that will come out of the strategy. But again, it does speak towards how the structures and systems play into some of the health risks and challenges, and that it's not, it's good. It's okay saying to the young lads, get off your computer and go out and go do something. But if there's nothing to do,
exactly, that's it.
Yeah.
With that choice, like my boy is 12, and you get to the point of holiday clubs as well. And there's nothing for them to do on holidays. They cut off at 12, so there's nowhere for him to go.
Yeah.
And so either I have to take the time off work and entertain him, or I'm kick him out. And there's gangs around here where he doesn't want to go out and mix with that, or he sits in the house and plays on screens. And literally, that's it. That's your only option, is screens. So it feels to me, we talk a lot about screens, but actually the problem isn't the screens so much as the lack of opportunity to do anything else. Yeah,
it is. And I think diversity of activities is important, is that demonizing screens and online connection is not the answer here, I don't think. And there's evidence shows that boys can get, and young men and older men can get a lot of value from connection via online. But if that's the only thing, then that's when it becomes problematic. And we know that, that getting out and just the physical aspects as well of being able to be outside in your communities, feeling safe and engaged and connected, has a lot of benefits. And so we really need to take the same type of approach to supporting change, behaviour change in that regard, as we do with other public health issues, like, for example, cycling. If we want more people to cycle in our communities, the evidence clearly shows that you don't just tell people to cycle, you actually build infrastructure that helps them feel safe cycling, more cycle paths and more green space. And that then gets more people cycling. Just telling them to do it doesn't work, because because it doesn't overcome the barriers that they feel, like safety and risk. And it's the same thing when we're thinking about how can we affect change within our communities around different behaviours, like getting boys to connect more in safe spaces and in activities that helps them feel connected.
I think we finally recognize that when it comes to men's health, it's not just a men's issue. We need to fix the infrastructure around it. And I think that's we've been doing this work for a while, but that's a new kind of national conversation. And it's great to hear that. Let's talk about the kind of class within this, that men in the most deprived areas are likely to die over 10 years earlier on average, and have on average nearly 19 fewer years of healthy life expectancy. So I've started to go to a nice gym over the last few years, which, Jodie and Katie have heard about this many times.
Gym,
But but it's only in going to this nice gym that I realized how much class has an impact on health, because we're going there as a family. We're going, like, the kids are playing tennis. They're in the soft play. We're eating healthy food. There's a creche. The parents are going to the gym. They're playing paddle, which is the new thing. And I'm like, wow, I didn't realize when you have money and access, you can work out as a family. And when you don't, like, it's very hard to do that.
Yeah.
And I didn't make that connection. But now I'm firmly middle class. I've gone over the fence from working class to middle class.
Definitely if you're playing paddle.
Exactly. I'm there. I'm not denying it. I'm sitting in my middle
Lean
class
into it,
now.
definitely.
It's fine. I've acknowledged it. I've come at peace with it. But it's massive. And I think most people don't know, because maybe they don't go from either side. So you don't know what the other person's experience is like. So in the strategy, and interested in your opinion as well, how do we help the people that need it most in regards to the men that are really struggling? What can we do to actually zone in on those people?
Well, that's the main story of the men's health strategy. It's a health inequalities issue, right? And it's deprivation is the key factor that shapes everything in terms of patterns of health outcome. Because it's, as you've outlined there, the differences between different groups of men far outweigh and outstrip the differences between men and women. And really, the success of the strategy, the men's health strategy, will come down to the ability to address the challenges that men who are facing the greatest disadvantage in our society experience. You've outlined there the difference in life expectancy and healthy life expectancy. And those things are reflected right across other conditions: cardiovascular disease, respiratory conditions, liver disease, diabetes. These are the major contributors to premature death in men, and tend to be clustered around preventable risk factors such as overweight, obesity, diet, physical activity, alcohol consumption, access to health services, amongst other things. And so we really need to be thinking about those things and how we can support and engage men earlier in health promoting behaviours to ensure that they have got every possible chance of living longer, healthier lives. And so when we think about, for example, stopping smoking services, around gambling and addiction services, around weight management and physical activity services that are available, we should expect that those services that exist within our communities reflect the needs and preferences of the men who are experiencing the greatest challenges. And so the strategy is not necessarily about just, well, here's X amount of money to do this particular pilot or parallel system. It should be baked in to our public health systems such that they tackle that level of inequality that exists within our country in the same way that we address other inequalities, but it's just taking a men's health lens to it. And I've said for a number of years that this is not about creating a parallel system or service for men. It's about integrating it into business as usual. For the guys who can't afford to have the time to go to the gym, or for the guys who can't necessarily afford a balanced, healthy diet, or perhaps don't know, or so supporting those things early is really the key here to getting sustainable change and improving the lives.
Yeah, it's so important. I grew up in Wembley, northwest London, and when I go back to get my hair cut, I walk down the high street and it's just chicken shops and betting shops. You're like, what? There's chewing gum on the floor. There's spit on the floor. The buses are quite dirty. Don't get me wrong, I love Wembley. Anyone listening from Wembley, I love Wembley. I grew up there. But you can see the difference in the environment to other areas in and around. And I think it's it's a real challenge to get through to people who on a day-to-day basis are just thinking about surviving. Their health, unfortunately, is not on their priority list when you haven't got money, and when you're looking for a new job and you're just struggling with getting your kids into a good school and all those sort of things. So yeah, it's a massive thing to address. Can we talk about fatherhood? We've spoken a little bit about being a dad and how we need to make our systems more fatherhood inclusive. We know that 5 to 15 of fathers experience anxiety during the perinatal period, and 5 to 10 of fathers experience depression. But currently, in most NHS trusts, dad's mental health isn't routinely checked. And obviously that impacts their health, which impacts the health of their child and their child's outcomes. So, me and Jolie, we always talk about paternity leave. We couldn't have this conversation and not talk about paternity leave. That's impossible. I didn't see paternity leave mentioned in the strategy in regards to it being an intervention. Obviously, there's a parental leave review, so it may have been that, the Department for Health decided to leave it to DBT. But what would you think about how at least 6 weeks of paternity leave would impact the health of dads and the health of families if the government was to introduce that in the parental leave review next year?
Yeah, it's massively important, and important on so many different levels. I think fundamentally we can't have the conversation around the importance of fathers as key contributors to the well-being of families if policies and structures don't reflect that. Having a minimal amount of paternity leave, it's not just an employment rights issue. It's what messages that's sending in terms of the value and contribution of fathers. And so I think we're going in the right direction there. There's definitely more to do, and we need to think beyond just that magical figure, which I think is important, but it is around a recognition that, as you said, we've done some research here. I've had a PhD student looking at the data around perinatal mental health, the mental health of men and women, and mums and dads during pregnancy and the first 12 months afterwards. And it's really clear in our findings that there's a two-way relationship. So if dad's unwell, it affects mum's mental health. And if mum's mental health is poor, it affects dad's mental health. And both of those things affect the child's well-being as well. So if we can help families stay well, both mums and dads, then it works to everybody's benefit. And our services and structures need to reflect that. So I think we need to keep pushing this towards not just, we need dads to be given opportunities and for it to be normal for dads to have that paternity leave so that they can support the well-being of mum and of the kids, but also for themselves as well as dads, and see them in their the well-being of fathers in their own right. Because we know that if fathers are well, then it has positive ripple effects throughout the family and throughout communities. But importantly, I always talk about the recent Freedom of Information request that was done on the police force around paternity leave that showed that many policemen were ridiculed and ostracised if they took longer than a week of paternity leave by their colleagues. I think it was the dad shift who did the Freedom of Information request, was reported in The Guardian, which is a really good example of it's not just about telling dads that they need to take their paternity leave. It's about how the wider systems respond to that. Because as an individual dad, if you're going to be ridiculed and ostracised in your workplace for taking that action, then it's a logical reaction to say, I'm not going to do it. In the same way, that taking time off if your child's poorly, or putting your family first in that way. If that's viewed negatively in your workplace, in your community, then it becomes natural and logical action to not do that. And so rather than putting the focus of intervention on individual men to say, you need to take fatherhood seriously and you need to take paternity leave because this is important for these reasons, it needs to be normalised in workplaces, it needs to be normalised in communities, it needs to be normalised in our policy at a national level as well. And if we start to do that, then we'll start to shift what's normal and what's expected. And we see, fatherhood is a really great example of how ideas of what it means to be a man in society are not fixed. They evolve and shift over time. And we can all recognise that, us as dads, and our role is very different to how our fathers might have parented, in the same way it is for mums as well. But those things can change really quickly. And, in my father's generation, you'd never carry a baby around in a baby beyond, or you wouldn't carry a baby in that way.
Yeah.
But now you do. That's normal. It's
Mhm.
expected. In fact, it can be quite cool. And,
Yeah.
so you can help shift and normalize these things. And then that'll help our kids think, well, that's normal. It's normal for me to kind of take that time. It's normal for me to be involved like that. And so, yeah, I think the paternity leave is a key element of it, but it's also shifting norms and expectations in places where men are living and working as well.
Yeah. Yeah, definitely. I mean, I went to the school pickup on Friday, and I was at the back acting very strange, but counting the number of mums and dads that were doing the school pickup. And I counted there were an equal number of dads there, which is incredible. And that's, yeah. So we are seeing change, but I completely agree on the culture. We do a lot of work with businesses, and there's a law firm that we were called in to go into last year. And on paper, they offer this amazing 6 months equal parental leave policy. They've done a press release about it. You'll see it on the news and whatnot. But going in to speak to the dads, they will tell you, my manager has told me if I take this 6 months, it's career suicide. Do not do it. You won't get promoted, and so they don't. So the average is still a few weeks. So the main thing we have to do alongside the policy is culture change, it's normalization, it's amplifying role models. It's really talking to line managers and making sure they are supporting their employees to take
and
the lead.
living it as well. You've got it's one thing saying it, but people have got to see other people doing it and not be penalised for it, actually be rewarded, and then you can think, well, it doesn't matter what the policy say. The policy is one thing, but they're doing it, so that's normal now. And I think it sort of speaks to a broader point around how you shift norms about masculinity and what it means to be a man. Because if guys are rewarded either overtly or inadvertently for cracking on, focusing on their careers, working through difficulties, whether it's family or health at work, being stoical, solving your own problems without complaining throughout their lives, then to expect guys to kind of shift that when they become ill becomes really difficult. Celebrated for doing those things all life, and it becomes internalized. And it's not necessarily that a lot of guys will think, well, I'm going to wake up today. I'm going to be stoical today. It just becomes normal.
It's what you do.
Yeah, exactly. So I think to shift those things, we need different versions of what it means to be a man. Whether that's in relation to father, whether that's in relation to how you respond to your health, that other people can see, celebrate, and then act in accordance with.
So, Paul, in your foreword in the strategy, you say the real test is whether we can sustain momentum beyond this initial publication, embedding men's health into routine commissioning, workforce planning, digital innovation, and community engagement. So it's been 4 months since we went to number 10.
Yeah.
So Sir Keir Starmer give his talk, which is actually quite a good talk, to be fair. It was a nice kneeling, wasn't it?
It was.
What have you seen? Have you seen kind of steps? I know it's 4 months, but have you seen steps that gives you hope that this strategy will actually be turned into actions? Those actions that are outlined will be delivered. Have you seen positive signs? What's been going on so far since the publication?
Yeah, I mean, it's early days. It's 4 months, and the strategy really should be seen as a foundational document as well. It's kind of the first part of the conversation, a longer term conversation. But I've seen really positive signs in terms of an enthusiasm from health leaders, from workplace leaders and industry, who I think many of whom have been really champing at the bit to be able to tackle this. And I think what the strategy does, certainly at its base level, is give permission to talk about this and take action. And so I've been doing a lot of work with local authorities and going and speaking with county councils about their public health systems and how they can respond to the vision that's articulated in the strategy. And there's great enthusiasm to do that, and do that alongside the women's health strategy, and bring those things together to think about how can they make sure that services are as gender responsive as they possibly can be. But, what we need to see is implementation. We need to actually see real change happening. It's very early at the moment to see the effect of that. But I think, that is where we'll see success. That's how we'll know that things are actually beginning to change. And my fear with the strategy was always going to be a dusty policy that's left on the shelf somewhere. That's not my experience so far, but it's part of my role as chair of the Men's Health Academic Network, but also as the professor of men's health to kind of keep pushing that agenda and make sure that it stays on the agenda.
Yeah, and the stuff with the Premier League's kicking off together against
Yeah.
suicide. We're doing an event actually with Arsenal and the Premier League. If you're around, Paul, 13th of June. It'd be great
Yes.
to have you as speaker.
Yeah. No, I love that.
Don't have to say yes now on the podcast. I tend to do this. I ask people live on the podcast if they want to come and speak.
Well, I am.
But I'll send you an email about it.
Yeah, I'm a Leeds United fan, but I don't mind coming down to it. I'll do that.
That's all right. That's all right. So before we go, we can't not ask you about what everyone's been talking about over the last couple of weeks. Obviously, the Louis Theroux documentary, Inside the Manosphere. And as you know, for people who work in this space, it seems like every couple of years or every year or so, something happens, adolescence, and it brings this conversation to the mainstream, which I personally think can be a good and bad thing.
Yeah.
What did you think about the documentary? What kind of conversations have you had off the back of it?
Yeah.
As well.
Yeah. Well, I mean, I watched it with my wife, who, and as I said, we've got an 11-year-old son. So this is kind of a personal, concern as well as a professional one as well. I'm also a big fan of Louis Theroux, so, but I was shocked by it. I kind of know a fair bit about online influencers, masculinity influencers, and I was really shocked. And then there's been a lot of noise, like you said, about this, but a lot of commentary, a lot of discussion. And I think the challenge is if we stop at shock, right? If we just say this is shock, this is terrible, this is abhorrent behaviour by these guys, then I think we're going to lose there. I think what it missed is what the documentary missed was a focus on why the content that these guys that were the focus of the documentary are creating is appealing to a lot of men, and not just boys and men, and not just those guys, but sort of the general masculine influencer space and masculine influencers. And this is a bit really, in terms of evidence and the science understanding around it, is really at the frontier. We're kind of just developing our knowledge and understanding of what the impact is, and then how to sort of address some of the challenges that come out of some of the detrimental impacts. But what we do know is that a lot of guys are genuinely looking for advice and guidance on how they can succeed as a man in life, at a time where we know that those historical pathways to becoming a man have changed greatly, and it's very uncertain for a lot of young guys growing up. Is, well, what do I need to do? What is the answer? How do I succeed? How do I become successful and as a man? And I think the masculine influencers are tapping into that and offering relatively simple messages that the evidence shows that actually work to give guys a much greater sense of optimism in the future. Research by Movember showed that, of guys who engaged with online influencers of this kind, it benefited in terms of how they felt. It was empowering in many ways, but unfortunately as well led to increased psychological distress and higher levels of restrictive perceptions around restrictive gender ideals as well, and misogyny. So rather than just condemning guys and saying this is terrible, you should not be engaging with these guys, we need to understand why, and then we need to offer an alternative. And I think that was the thing in the documentary for me, is that I would have liked to have heard from guys who are offering positive alternative online content that's also appealing, that's addressing some of the challenges that men are seeking answers to. And so we're right at the beginning of the learning, like, well, what does a positive alternative look like? Prohibition's not the response here, so we need to kind of just understand why, what men are looking for, what boys and men are looking for, and then being able to offer alternatives that answer those things in much more healthier ways around what it means to be a man, in the same manner that we've been talking about some of the health-related role modelling that we have.
I think that's really interesting and really on point, Paul. And I mean, I also think, I'm going to go back to youth clubs again. I also think they're looking for community in some regards. I think they're looking for lessons for how to be a man. And we heard that from Josh, didn't we? We interviewed a 15-year-old boy who had got pulled down the whole of the Manosphere and sort of managed to escape it again, and was very thoughtful about what had led him down that path to begin with. And it's exactly as he said, he was looking for this advice on how to be a man, and he found it very empowering. He was like, right, start a business, right, work out, right. And then suddenly realized actually a lot of this stuff is really problematic. But I do also think there is that, you know, they get a taste of community from following these idiots, and they love it. They're like, I want more of this. I want more of that community. I want more of feeling like I'm part of something, because I think boys just don't get that anymore from day-to-day life as much as we did when we were younger.
No, I think you're right. And again, that's understanding why they engage in it, whether it's like financial advice, whether it's dating advice, whether it's physical working out advice. That's what the evidence shows that guys are looking for. But then the algorithms will eventually kind of start presenting them with more extreme content that then offers very simple answers to the challenges that they are really and if we stop with outrage and shock, then it'll just push that underground, and it won't address the real problem that many young men are facing, that you've just summarised there. Is they are looking for answers around what does it mean to be a man? Who do I need to be, and what do I need to become, and how do I become the things that I want to become? So yeah, we need to, and I as a parent very much as well, and thinking, well, what does that mean for us as parents, and how do we manage that? And I think it's important that we keep it part of the conversation, but it's absolutely important that we keep grounded in the evidence as well, and not just the noise around shock and appalling and hot takes.
Yeah. Well said, Paul. I enjoyed the documentary. I was asking for a part 2 to have the alternative voices, to talk more about the causes, the impact on women and girls, and violence against women and girls. But for what it was, I think it was fascinating, and I learned a lot actually. So it's a great watch. Paul, we could talk all day. We could talk all day. We could.
You have to get me back on, and I am busy.
Yeah.
So are you, but
we're all busy.
You'll have to get me on another time, maybe when we're a bit further down the line in the implementation of some of the men's health stuff.
We'd love to. Let's make this an annual thing. We'll book you in for next year. But no, you've been great. So insightful. I love the stories that you've got, your insights. I think you've brought a fascinating perspective to the conversation. So thank you so much. Where can people find you if they want to follow up?
Well, if you Google my name, you'll be able to find my email address very easily on the University of York website. I'm also on socials as well. So, I'm more than happy to engage with people, whether it's through email, social media, hear people's experiences, but also how they're kind of addressing some of the challenges that we've spoken about in the podcast. So, yeah, please do reach out. One of the upsides and downsides of having a name like mine is that there are a few Paul Galdases around.
You can find him. He's out there, people. Search him. You'll find him. All right, Paul, thank you so much.
Cheers, Elliot.
Thanks,
Charlie.
Cheers.
Thanks. Bye.